You or someone you love is in a serious accident. The help you need doesn't have to wait until the ER. Vermillion Fire and EMS says it is the first ground ambulance team in South Dakota to carry blood products.
This initiative is part of the Blood Out of Hospital Acute Resuscitation program. It's also known as BOAR. KTIV's Taylor Deckard shares how they need more blood to make that happen. Taylor?
Yeah, that's right, Matt and Jessica. Vermillion is proving that saving a life doesn't always start in a hospital. Sometimes it starts on the side of the road with the blood at the right moment. And today they hosted a blood drive to help support the supply of blood carried on their ambulances. On Thursday, community members ready to donate blood filled Vermillion, South Dakota's fire station. People like USD student Sam Miller, who donated to honor his grandmother, who often needs blood.
Makes me happy, you know? Makes me feel like I'm actually doing something to solve a problem.
If you are ever in a serious accident near Vermillion, EMS has blood on board.
The blood has been a big factor in patient survival and care.
The BOAR program is like a transfusion that can start on the street before the ambulance arrives at the hospital. Paramedics recently put the BOAR program into action after a bad car accident.
In that time frame, we were waiting on helicopter services to arrive. In that time frame, we were able to get IVs started and get blood products beginning to be administered prior to helicopter services arriving.
Chief Matthew Callahan says the patients get blood as soon as they need it, more quickly than waiting for the transfusion at the hospital.
That 15 minutes can buy a lot of time for that patient.
If you're ever in that ambulance, this is what could save your life. But before it can get to the patient, donations are needed to keep blood levels up.
Everything is always low. We're going into the summer season and people get out of their routines. Kids are home from school, they have less time, they're going on vacations. So that's why the summertime is always really important.
Vermillion EMS carries both red blood cells and plasma.
I guess I played good.
Thursday's goal was to collect 50 to 60 units of blood.
Getting local donations to help fund that or build that blood supply is crucial.
It makes me feel like I'm doing something. It's really easy. I'm young, so I got a lot of blood to give.
The BOAR program is part of the Vermillion Fire and EMS budget under the city's budget. Chief Callahan says other South Dakota EMS agencies are considering this change. Matt, Jessica?
All right, KTV's Taylor Deckard for us in studio tonight. Taylor, thank you. Now, right now, LifeServe Blood Center has critically low levels of several blood types and needs donations of O positive, O negative, as well as A negative and B negative. To find a blood drive near you, check out this story on KTIV.com.